Good afternoon. I'm District Superintendent Joanne Antonacci, and I'm facilitating today's Act for Education Public Schools in Action Roundtable. In today's segment, we are pleased to provide school health updates with Dr. Mendoza, Commissioner of our Public Health for Monroe County, Kathy Groutman, Greece Central School District Superintendent, and Mary Groh, East Arundecoit School Superintendent. Thank you all for being with us here today. Act for Education is an unprecedented initiative that delivers positive messaging about the impact of public schools through a unified voice, collaboration, and community partnership. And community partnership has certainly benefited our region during this pandemic. This initiative was launched in 2014 with 22 participating districts, including the Rochester City School District, BOCES 1, and the Monroe 2 Orleans BOCES, along with nearly 24 businesses and community partners. We invite you to visit the rest of Act for Education's website after this roundtable and follow us, please, on social media. ACT is holding these bi-weekly webcasts to provide our community with accurate, up-to-date information about our local schools during this pandemic. We recognize information about COVID-19 is complex and ever-changing. Hopefully today's segment will be informational and provide you with some further clarification. A couple housekeeping pieces. This segment was pre-recorded. If you're watching on Thursday, December 17th at noon, the chat will be live and we will try to answer the questions as best as possible. This segment and all roundtables will be available for future viewing on the Act for Education website. So we're going to begin today roundtable with our Commissioner, Dr. Michael Mendoza. Dr. Mendoza, can you give us an update since we last saw each other?
Well, first of all, thank you, Joanne, and thank you to my colleagues, Superintendent Groutman and Superintendent Groh, for having this conversation. I think we have come quite a way since the last time we had our last conversation. The numbers in the community, as you know, have been increasing, meaning that the number of cases has increased, the number of hospitalizations has increased, and sadly, the number of people that we've lost to COVID-19 has increased. And this raises a lot of concern. And I think as parents and others in our community look at these numbers, we all ask ourselves, what are we going to do to turn this around? And I think the answer to that lies in our schools. You know, when we look to what we need to do as a community, I think we need to look no further than our own schools to see what precautions done properly can do to mitigate the spread of COVID-19 in our community. And so although we've seen the numbers going up in our community, the amount of spread that we're seeing in our schools has remained exceedingly low. And so as we look at our numbers, as they come out every day, you know, you will see a larger number of individuals under the age of 20 and in our school age population increasing. But it's really important to understand that transmission is not happening in the schools. It's happening in the community where our kids, you know, play and live with their families and with their friends. So as we've seen across the state, as we've seen here in the county of Monroe, the vast majority of transmission, regardless of your age, is happening in small private gatherings, typically in our own homes.
Dr. Mendoza, one clarification there. Even though students are testing positive, that doesn't necessarily mean the transmission is in schools. If you can clarify that for us?
That's correct. We are seeing children testing positive, and that is true. These children have the COVID-19 infection, but they are not getting it from the schools. When we do our contact tracing, when we speak to the parents and to these kids when appropriate, very often, almost entirely, the transmission is happening outside of the schools, in their homes, in their communities, occasionally related to school sports, but never really in the classrooms themselves.
The other piece that's come up quite often before we turn this over to the superintendents, Dr. Mendoza, is contact tracing. Can you talk about how the Department of Health has expanded that a little bit and what assistance they're using from school districts?
Well, as the number of cases has increased, and it's upwards of 600 a day on some days, we have been working very hard to expand our ability to reach all of these individuals. With every individual who's positive, our team calls them and tries to help them to identify all of their contacts. First, we inform them that they have the infection. Almost always, they already know this. And then our next job is to identify anybody beginning 48 hours before the onset of their symptoms, if they had symptoms, or 48 hours before they had their test done that came back positive, all the way up until present time, we try to identify anybody who is a close contact. A close contact is defined as anybody who was within 6 feet for 15 minutes or more when either party was not wearing a mask. So if both parties were wearing a mask, even though they were within 6 feet for more than 15 minutes, we will not consider them a close contact and we will not consider them eligible for quarantine. But if they met that 6 foot or less, 15 minutes or more criteria, and they were not masked, then we will identify them as a close contact. Now, the challenge, of course, is with all of the numbers that we're seeing, we're not able to reach all of these individuals as quickly as we would like. And so even though we're trying to expand our workforce, we've hired now 100 additional employees to work on this, we're still not getting to everybody as quickly as we would like. And so what we're asking is for our schools and for our parents to get the ball rolling. You know, we don't expect anybody else besides us to issue official quarantine or isolation orders, but what we're asking for is to have communication. So if you're a positive individual, we're hoping that you can think back and help us to identify who those contacts might be. And if you feel comfortable contacting them, letting them know that they might be at risk while we are in the process of getting in contact with you. It's a way of helping to start the process a little sooner, but it certainly is not meant to substitute for what we're doing in the health department. So we simply ask for people's awareness and to take some precautionary measures. But at the end of the day, we're going to still contact everybody as best we can.
And that's the criteria that you've set up for Monroe County. It may be other counties may have a different criteria. Is that true?
That is true. I think different counties will look at it slightly differently, but here in Monroe County, we give credit, if you will, to wearing a mask.
Thank you. So let's now go over to our superintendents. And we'll start with Superintendent Kathy Groutman. Kathy, can you give us an update on your district and your perspective on the testing, contact tracing, and where you've come since we started school?
Sure. I guess what I would start with is some sincere appreciation for being in Monroe County and being able to partner with our Department of Health and county executive. So I think here in Monroe County, it's been just a huge strength for us in terms of our relationship and how much we've communicated and talked together, which has made that whole process so much easier for us in the schools. So I will say, when we were first deemed yellow and had to test 20% in a short amount of time, that was pretty overwhelming for us as a school district. Not being set up to do that, that's not, our first set of work that we typically focus on. So that was a lot of work to set up, but ended up going very smoothly with the support of the Department of Health. So the idea of getting tests easily, the idea of thinking through procedurally, that was great. Now we are into having some schools in the orange and having to continue with the 20% testing each month. And that is a piece of cake. And I don't want to diminish the hard work that's going in our schools, but overall, because of the work that was set up in yellow and because of our partnership, we've got a nice process set up. It's going smoothly. I think our parents have felt more comfortable. So initially, that was part of the concern, was getting consent from families and really having people understand what the testing looked like in schools. But because we were able to offer opportunities for parents to be able to come in and see it with their child, and because we've really worked on improving and just adding communication, I think people feel much more comfortable with that. And overall, I would say it's not a bad process at all. It's going well.
Thank you, Kathy. And Superintendent Mary Groh, your perspective?
Thanks, Joanne. Yeah, I think I would start by echoing what Kathy just said. I think it's really very appreciative of the partnerships that we have with both Dr. Mendoza and the County Department of Health, as well as Adam Bello's office. It's been just those collaborative relationships that have really helped to make testing in our schools so smooth. And echoing what Kathy said, I think initially as a county, when we heard that we were in yellow in our schools, it was overwhelming to wrap our hands around that. But after going through it and working with these different departments, it's really made things much, much easier on us. I would also say same thing with the orange. When we hit news that half of our district was going to be in the orange, it was pretty intimidating. But again, it's another system and we worked through it with those relationships and things fortunately continue to move smoothly. I will also say, just to echo what Dr. Mendoza shared in terms of what schools are doing to mitigate risk, we've tested well over 1,500 students and staff members since the end of November. And out of that, we have only had 3 positive cases. And I think that's testament to the measures that we're implementing in school with masking and hand washing and social distancing that is really resulting in positives, meaning that we are not getting positive COVID cases.
I would add on to that too. Our positivity rate was right around 0.2%, which was extremely low. And I also think what I can say, and I only could speak for both Mary and I, in terms of the advocacy that went into adjusting the requirements within the orange zone. So that given what we know from the data and just the support that we got from the Department of Health and our county executive around adjusting that. So it's doable, it's manageable, but we're also keeping a pulse on the infection rate in our schools.
So Dr. Mendoza mentioned the contact tracing, and we talked about how schools and the Department of Health are trying to assist one another. Mary, can you talk about some of the positives you got. Can you expand on how your district is helping with the contact tracing?
Sure. I will give much credit to our school nurses. They have been working tirelessly since the beginning of the start to school, and they've really been essential in having those sometimes daily contacts with Monroe County Department of Health. We also have an assigned safety coordinator for COVID here in our district, and that person has also been essential. So I think it's really working together as a collaborative to stay in touch between the school building nurses, our COVID safety coordinator, and then having such access to the Department of Health. Dr. Mendoza's team has been incredible. They literally respond at all hours to a phone call or an email. And I know at the beginning when we had our first cases, we really were worried about what does this mean? And I think we've learned so much through Dr. Mendoza's office and through our collaboration as Monroe County superintendents to really work together through this, compare notes, problem solve. And I think that's been really paramount, and also working through the contact tracing pieces, working with families, reassuring them, helping to point them in the right direction when it's time. Make sure you consult your primary care physicians for questions that we just can't answer here in school, and really just keeping the lines of communication open.
Kathy, anything you want to add there on the contact tracing?
No, I think the biggest piece for me to echo is the work of our nurses. And in many cases, we have a medical director that honestly has been Herculean in terms of her efforts around communicating with our nurses on a daily basis, communicating with families on a daily basis, but really taking the lead from the Department of Health in terms of the training around contact tracing and how to ensure that we're really communicating well with our families and giving them the best information possible.
Okay, thank you. So as I look outside and I see the snowfall, it reminds me that we have entered into the indoor sports season. Dr. Mendoza, what types of precautions and protocols do you recommend, and are you talking to the schools about in terms of indoor sports?
Well, it's true that indoor sports are upon us now. And the challenge that we're facing is that we don't have very much experience with how to conduct indoor sports during a pandemic, and certainly during the COVID-19 pandemic. So to start things off, let's start with what we know. We know that close person-to-person contact is the most high-risk interaction that is likely to lead to spread. And if we can borrow at all from what we've learned throughout the fall sports and the outdoor sports, most of the transmission there did not happen on the playing field. Most of it happened on the sidelines or in the stands or at home, either before or after a game. And so I think we have to start with that. As we look ahead to so many things that are still unknown about the winter sports, let's remember that those in-home interactions before or after practice, before or after games, those are the most risky as far as, sports-related transmission. So now is not the time to have the pasta party right before the game and so forth. This is the time to really buckle down and do what we know works. That being said, I think we need to also be open to all of the things that we're still continuing to learn. And so a lot has been said about the varying risk of different types of sports. So, I'll start with what I consider to be among the lowest risk, which is swimming. We know that this is an airborne transmitted virus. So when you're swimming, there is really no risk of gaining the infection while swimming. Again, the biggest risk related to swimming is when you're out of the pool, in the locker room, and coming and going to practice or to a meet. Other sports like bowling, relatively safe. All of the indoor sports are otherwise relatively safe. Indoor track and field, relatively safe. The sports that are a little more concerning really are wrestling and basketball. Because of the nature of those sports, those are the ones that give us the most pause. Hockey, ice hockey, also relatively risky. But again, let's start with what we know. Let's be very careful about those person-to-person gatherings off the court or off the ice or off the field, because I think that's where the majority of the transmissions that we've observed have happened. And so as we look ahead to what we don't know, will come down as being permitted or not. Let's at least do what we know, which is to be very careful around those interactions and wear our mask whenever possible. Some sports it's going to be impossible. Obviously, swimming, you can't wear a mask. But if you're bowling, potentially you could. So whenever possible, wear your mask. Let's do everything we can to continue these sports, because let's recognize that sports are important. In the grand scheme of things, we'd like to keep sports open too. But the way we do that is by taking our precautions.
And Dr. Mendoza, can you just speak for just a moment about the cardio aspect of this? We know that across the nation, they're looking at this different associations, and obviously our physicians in our county have. What should be coming out on that?
Well, the challenge with this is that thankfully, complications related to COVID among kids is rare. The challenge, of course, is that it's going to take longer for us to gain experience enough to create guidelines to allow us to have, a relatively, stable practice. As we've learned about COVID in younger individuals in K through 12, for example, we are becoming aware of very rare, although very serious cardiac complications. So kids and adults can have an inflammation of the heart that can lead to heart trouble. We know that there is an increased incidence of developing blood clots related to COVID. And so as we learn more about this, we want to be very careful because I don't think anybody wants to put our children at risk for those complications. But at the same time, we need to balance because we certainly can't take everybody out of the sports out of fear for a relatively rare complication. So new guidance has come out from the American Academy of Pediatrics as well as the American College of Cardiology. These are the two leading organizations when it comes to developing cardiological guidance related to sports. And they have all said at this point that in anticipation of these potential complications, though they're very rare, we essentially want all kids to be evaluated by a primary care physician first before returning to competitive sports or exertional activities, of which physical education may be an example. So that is the change as of today, and the guidance is likely to change again. But again, we're implementing these across the county, and we'll be releasing guidance very shortly that shows an algorithm for how parents, school physicians and nurses, and the health department will be approaching this. So at least we'll have some consistency as we navigate these uncharted waters. But again, the reality here is that we don't want to put any of our kids at risk for these complications, because these complications would be potentially a lifelong complication.
Okay, thank you. So superintendents, we know that you want to continue, obviously, with safe activities in school. So Kathy, if we can start with you, how have you handled implementation of indoor sports in your districts in a way that you think is keeping students and families safe?
Yeah, so for us, that really only impacts 2 sports for us in terms of, looking at the entire season, which is bowling and swimming. That is manageable. And we spent a lot of time in the fall specifically looking at what would we want to implement as far as procedures. So we looked at the assurances that the state put out around reopening schools and tried to sort of apply that same mentality and thought process to opening any sport. With our fall sports, and same thing with our winter sports, we've asked families to complete an attestation where we just really sort of have them sign off saying things like that they won't have the pasta party after practice or before a meet, that they will make sure that they're wearing masks, that they will comply with the guidance and the recommendations around spectators at events. So, you know, at some events, there's no spectators. At some events, we're limited. But what we did is we did that just to try to build awareness and also try to ensure consistency and that we were really complying with the assurances from the state. So I will say point blank, because this was a big deal with our Board of Education and they were really vocal about the idea that we need to be safe, that our community has been amazing and has really followed all the requirements that we've put forward and have been great about it. So I feel really confident that our kids are safe. I feel really confident that our community remains safe and that this isn't putting us at risk.
And Mary, can you expand on how you're trying to implement safe sports?
Sure. It's really in line with what Greece is doing, to be honest with you. We're doing similar things. You know, in the fall season, we didn't have one positive case and we implemented a lot of safety measures similar to what Kathy just described. Every spectator, every athlete had their temperature screened before starting practice or a game. Everybody completed an attestation before entering any building or entering the field. Those same practices are now going to be, or are going to be implemented rather, into the winter season. And like Greece, we're starting off with bowling and swimming. So we don't have a lot of spectators at either of those sports, which makes it somewhat easier to manage crowds and things of that nature and handling the different measures in terms of screenings. So we're confident that that will keep us safe. Again, we subscribe to the hand washing and to masking, and we continue to be vigilant in implementing all of those to mitigate any kind of spread.
Is there any one particular message, Mary, that you'd like to send to your community on the sports?
Honestly, I would say thank you. You know, our families, similar to what Kathy described, have been wonderful. They understood what we were asking them to do when it came to compliance for not just their student athlete, but for also them as parents. Again, not having those pre or post athletic event gatherings is going to be important. And I think as more and more information is out in the community in terms of really stopping those kinds of gatherings, I think it's even easier to ask families to comply with that.
Thank you. So Dr. Mendoza, back to you. We often talk about health in terms of the physical. When you refer to the overall health, what does that mean to you as Commissioner of Department of Health? What other important metrics of health are you looking at, in particular social, emotional, and any others that you can share with us?
Well, one of the challenges with this pandemic is that all of the headlines are related to COVID-19. And it really doesn't, reflect all of the work that we do in the health department behind the scenes, all of the work that we had been doing for decades, long before COVID. And, the amount that COVID-19 has been in the headlines really misrepresents how much I think about all the other aspects of social emotional health, particularly pertaining to kids in our K through 12 schools. And I think it's going to be a while before the final chapter on this entire pandemic is written, but I think it's very safe to say that there have been a lot of trade-offs that we've had to take together as a community to get through this crisis, whether it's economic or mental health or social, interactions and all of the good things that come from being social beings. We've made a lot of compromises, a lot of sacrifices. And I don't want to underestimate the gravity of all of the sacrifices that we've taken together as a community. But make no mistake, there has been a major mental health impact to all of this. I don't think we fully even understand the breadth of what this social isolation and disconnection has done for the mental health and the socio-emotional health of our kids and our parents and all of us. So we're following this, for kids, we're really looking to make sure that our kids are having a space to have a conversation with adults, having safe conversations with adults. We want to ensure their safety. Unfortunately, we've seen across the country, reports of child abuse have become more severe. And so that tells us that we've got to be paying attention to the safety of our kids, and we've got to maintain open lines of communication with our kids. So we're measuring all that, we're following all that. We're looking at access to food, and we know that many of our families are struggling with food and housing and accessing basic social services right now. So we're paying a lot of attention to that, making sure that we can connect, whether you're in isolation or quarantine or not. We want to make sure that everybody has access to those important services. And then when this is all done, I hope to resume, if anything, even strengthen the relationships that we've been trying to develop with our schools. About a year ago, I met with all of the school counselors from all of the schools, and I asked, what can we do as a health department to partner to do a better job to take care of the mental health of our kids? And universally, they said, better education around mental wellness earlier as best as possible. And then there was a call for help as far as how do we help the kids who are in crisis or about to become in crisis. What are the crisis options? What are the mobile crisis, and how do we connect these kids? Because the school nurses and superintendents aren't equipped to handle acute mental illness concerns in the school. And so those are the things that we're looking to do. But we're all looking to get past this pandemic, and we're all looking to get back to that important work. But make no mistake, the mental health of our kids and our teachers and our families has been a really huge area of concern for all of us.
So very important. Superintendents, Kathy, let's start with you. How are you addressing the social emotional health for students, families, and your staff?
Yeah, this is a gigantic question that we could probably talk about for days, but we've done some pretty explicit things early on. We've started this year with really sort of stressing the importance of connecting and building relationships with kids. So that is built into everybody's schedule each day. So even if a student is, whether they're in person or whether they're remote, there is an in-person connect time several times throughout the day with the intention of just checking in on kids. So that is first and foremost like a structural piece. We also have implemented social emotional screeners this year at all of our schools so that we could get a gauge on who are our kids that we are most concerned about, and that we could actually do better outreach with those kids that are more concerning to us. So the screener piece was new to us this year as part of the pandemic, and I think was really, really important, as well as just the idea that we're continuing to implement a lot of our programming that really addresses social emotional things like our primary project program for younger children or sources of strength for our older kids. So all of those things continue. I want to just sort of mention, we also have targeted our families. So we have a family support center in Greece, which has provided great support to our families. It's free. It runs every day, Monday through Thursday, and that has been full in terms of every appointment has been taken, and we continue to really connect families to that as a resource. And then we've used our parents in the community to help us with some more grassroots things around like parent exchanges and connect time, which they're doing virtually. And that was designed by some of our parents as a way of connecting them with one another around different supports and assistance and help. So they've had some that have just focused on how do you best help your child with learning. And then they've also had ones that are like more connected to mental health and social emotional support for younger kids and themselves. And then the same thing for staff. So we've tried to also look at staff as this other whole unit, because many of them are serving as parents, they're serving as educators for us, but they're also now serving as teachers for their kids while they're home and learning, and just recognizing that they really need time for collaboration. We've built in mindfulness settings and times throughout the week for our staff, but just more than anything, trying to make sure that they have the time to collaborate to get their work done so they're not so overwhelmed. So there's been really explicit, I guess to my point, looking at each individual group from students to staff to families. And many of the strategies are really connected and similar in terms of like building on those relationships and trying to build connections.
Thank you. We know that districts customize, obviously, their supports to what the community and the school needs. Mary, can you expand on what you're doing in East Iroquois?
Sure. Really similar to what Kathy had mentioned, one of the things that we added this year was a screener for our staff. So similar to what Kathy described in screening students, we do a monthly questionnaire. It's got about 6 questions for staff just to measure how they're feeling. Did they have a good week? How do they rate? Is it okay, or is it really good? Or, could they need some support? It gives some opportunities for them to put a narrative in there to speak directly to what their needs are. And then it also gives them an opportunity to choose whether or not they want follow-up. And so as we created our reopening plan for the district, we also had an SEL team. And that SEL team would be the conduit that would support staff who are willing to have an intervention, if you will. So that's one piece that's been really beneficial. Our counseling department has been wonderful. They've partnered with Liberty Resources, which is an outside agency that works here in our district to provide additional mental health support to families. And they created a series of workshops that are given in the evening for families to sign into. They're all, of course, virtual workshops, but they have specific topics in dealing with mental health strategies, things that are very narrow and very specific to what the needs are based on some surveys we've done here in our district. So it's something that I don't feel like we could really ever do enough when it comes to SEL support for students and staff, and certainly being able to take some of those best practices that we're using this year and stretching those into next year and making them more part of just how we operate, how we do business.
Very good, thank you. So as we draw to a close on this particular roundtable, I'm going to ask each panelist if you could expand on, something you'd like to share as we prepare for the holidays with the communities and what you want them to be mindful of. And then also, what gives you hope as we look ahead to 2021? Dr. Mendoza, we'll start with you.
Well, the holidays are a time for us to gather and to connect. And I think after a year like we've experienced, the need to connect and the need to have that support from one another couldn't be more strong than it is right now. The challenge, of course, is that we know that it's those very gatherings that put us at risk. And so, outside of our household, we've got to be very careful. We still have to be very careful. And I know it's very, very hard. But we ask that our community just stick it out a little bit longer because help is on the way. The vaccine for COVID-19 is here. I will be getting my vaccine tomorrow. The community will be on a path toward normal very, very shortly. So what we want to do is keep everybody as healthy as we can. Let's get through this as quickly as possible. Let's keep our loved ones healthy and safe. We've lost too many people this year to COVID-19. And the last thing we want to do is have as our legacy that we didn't do the right thing during the holidays of 2020 and lost even more. So what we're asking for is patience. And I know we've asked for patience all along, but I really do think that the end of the tunnel is really upon us. And I think if we can just work together a little bit longer, we'll get there. And I know we can. We've done this before, and I know it's really hard. But I do think that our better days are ahead at this point if we can continue to work together and connect as best as we can while taking all of these precautions at the same time.
Kathy, how about you?
I guess I would just end with absolutely a feeling of hope and optimism for the future. We, to Dr. Mendoza's point, I feel like have learned how to do this in schools and are doing it well. I think for me, I continue to focus on some of the positive messages. I was in a school yesterday and had a teacher tell me how she didn't feel like her kids, unlike sort of the narrative that has been out there in the public a bit around kids falling behind, she didn't feel like her kids were falling behind. She feels strongly that the structure and just within our hybrid model and working with a smaller group, she's able to have stronger connect time with all of her students because they're coming in smaller groups. So she was sort of looking at it in a positive way. And I really do believe that's true. And I also believe our kids are learning skills that they have never learned before, things around self-regulation and self-management that I do hear regularly from our kids as a strength and from parents. So while I know that there is a feeling of isolation and I know there are some pieces that people are frustrated with, I'm with Dr. Mendoza and that is short term and looking long term ahead at a positive spring and being able to be together and connect more.
And Mary, from you?
Yeah, I would echo all sentiments. I think that this year has proven that we can do just about anything. I think it's proven the resilience of our students, our families, and certainly our staff. We've put systems together that we didn't even know we were capable of doing in very short amount of time. And I think that's testament to the incredible effort of a team coming together. You know, I'm really hopeful for what's coming in 2021. Certainly can't be any worse than what was just in 2020. But no, in truthful, yeah, our kids are doing remarkably well considering how different school feels and looks this year, and our teachers are just amazing. And so I hope as we go into the holiday season that our families and our teachers and our students really unplug and give themselves some time to just rest and breathe and enjoy being outdoors, or just again, just kind of just unplugging for a while and really taking some time off.
Thank you very much. So Dr. Mendoza and superintendents, we cannot emphasize enough or stress enough how this partnership has got us through the 2021 school year. We know that we'll continue on after the first of the year. We'll find better ways to inform our communities and to support our communities. But I want to make sure we do a shout out to you, Dr. Mendoza, and your team for partnering with superintendents such as Mary and Kathy and all of us here in the county to try to make this through what we're dealing with in these challenging times. So I can't thank all of you enough on behalf of all the superintendents and the families and students that we serve. And viewers, thank you so much for joining us today. Again, special thank you to Dr. Mendoza, Superintendent Kathy Groutman, and Superintendent Mary Groh. We are going to be having this segment again go live on Thursday, December 17th at noon. We'll be answering questions in the chat. In addition to that, the segments will be posted on the Act for Education website as the ones that we've previously done. After the first of the year, we'll also be putting out a schedule in terms of additional segments that we will be doing, and we hope to get back on track of the every other week that we will be doing them. To all of you, we wish you happy holidays. Please stay well and please stay safe, and thank you for being a part of this community.